Thank you for joining us today as we prepare you for your upcoming total joint replacement. Providence St. Joseph Health System has done more than 1,000 total joint replacements a month and as a system have worked together to ensure excellent outcomes and an exceptional experience. So, welcome to your journey. We as Providence St. Joseph's Health are happy to be a part of your journey and have created this class to not only help you and your family feel more prepared for surgery, but to also give you the information needed to promote a smooth recovery. As you can see, our agenda will help take you through all the stages of your journey, from preparing preoperatively, the short time with us in the hospital, all the way through your discharge to home. It is our hope that we will be able to answer all of the questions you may have during the rest of this presentation. But should you have questions that may not have been answered, please don't hesitate to reach out to your surgeon's office or connect with your hospital's orthopedic program manager. With Providence St. Joseph Health, the safety of our patients, our caregivers, and our communities is and will continue to be one of our top priorities. Providence St. Joseph Health has been a leader in the battle against COVID-19. We've created safety measures and processes to ensure all of our safety. Providence St. Joseph Health is working with and following local, state, and federal protocols in all of our hospitals and clinics. Prior to your surgery, you will be required to show evidence of a negative COVID-19 swab test result. The timing of the test and receiving of the result is important. Your swab test will need to be performed no more than 5 days before your date of surgery, and the results of your test must be received by the pre-op department no later than 1 day before your surgery and no sooner than 3 days before your surgery. Once your swab test has been performed, we ask that you quarantine at home until your surgery. This will help limit any unnecessary exposures prior to your surgery. Please work with your surgeon's office to schedule your testing. Here are a list of the orthopedic program managers and their phone numbers for each of our hospitals. Should you have any questions, please don't hesitate to call. I'll leave this slide up for a few moments so you can write down the name and the phone number of the orthopedic program manager at the hospital you'll be receiving your surgery at. Having someone available to assist you during this journey will be helpful. They can be a family member, a friend, or a neighbor, possibly attending this class with you, visiting you at the hospital to see how well you are doing, and to familiarize themselves with how you might require gentle assistance. This healing coach should be available to assist you after you go home. You may not need them 24 hours a day. As you'll see, you'll be pretty functional when you go home. They will really need to be there for driving and any tasks at home that seem physically challenging, etc. For anyone coming to visit you in your room, visitors, staff, and physicians, strict hand hygiene should be followed. Please use the available hand sanitizing stations located throughout the hospital to ensure your hands are clean. And please use again when you leave the hospital after your visit. Now, patients should leave all valuables at home. But if you know you'll need to pay a copayment or your coinsurance once you're at the hospital, bringing the best method of payment for you would be helpful. We encourage you to bring your cell phone to help keep in touch with your family and friends. Some of our patients bring tablets or laptops and take advantage of our free guest Wi-Fi to stay connected. If you bring any electronic device, please remember to bring the necessary charging devices. Also, if you have sleep apnea and use a CPAP machine at home, please bring with you to the hospital to help make you more comfortable while you sleep. And let our staff know you've brought your CPAP and we can have it checked out. Though you really won't need much when you come in for your surgery, there are a few things you will need to bring with you. Please bring your picture ID and your most up-to-date insurance card or cards. Also, please bring any family contact information you'd like us to have on file. Please bring any paperwork, tests, etc. your physician may have given you. But if you don't have any, no worries. They normally forward all necessary information needed for surgery in advance of your surgery.
It is helpful to have a list of all the medications you take, whether they were prescribed, if they are over the counter, or if they're supplements. Our pharmacists will also review your list of medications and supplements to see if there are any possible reactions. If you have an advance directive, please be sure to share this with the staff so we can have that on file. If you have a blood donor card, please bring with. If you don't have one, no worry. The staff will type and cross-match your blood should there be a need. We want you to arrive to us safely, and we encourage you to use your usual assistive devices. But once you're checked in and under our care, your family member or friends can take your assistive device home with them unless you're planning to leave the day of surgery. Our staff will make available to you any assistive device needed while in the hospital and will help arrange for any devices or equipment needed when you go home. Any clothing you wear should be loose-fitting and easy to get on and off. Shoes, if desired, should also be easy on and off, and preferably something that has a full heel for safety. We will supply no-skid socks to use while you're with us. We would prefer that you wear glasses versus contact lenses during your stay at the hospital. Please let our staff know if you have dentures. If you do, please bring a case, as your dentures may need to be removed for surgery. If you require hearing aids, we encourage you to bring those. And don't forget those charging devices for any electronics you may be bringing. We encourage all of our patients who are 18 years or older to have an advance directive. It's made up of two parts. The durable power of attorney for healthcare allows you to choose a representative who can speak for you in case you're unable to speak for yourself. It also offers a living will. The living will allows you the opportunity to share with us what your wishes are in terms of your care. This is a powerful thing and can relieve your family of having to make very difficult decisions. Advance directives can be changed at any time. They can be completed at home and can be made official by either going through a notary public or two witnesses. Make sure we have your advance directive before your surgery. As one could imagine, there is a lot of preparation leading up to your surgery, and there will be a lot of instructions that you're going to receive. One area of great importance is knowing which medications you'll need to stop taking prior to surgery. Your surgeon and your primary care physician will help determine what you need to stop and when. It is common to stop taking medications that can thin your blood. Such medications can contain aspirin and nonsteroidal anti-inflammatory drugs. Examples of these are Advil, Aleve, Nuprin, Alka-Seltzer, Motrin, Meloxicam, and Ecotrin. These are normally stopped 7 to 14 days before surgery, but your surgeon will tell you specifically when you should stop taking these. Now, if you take blood thinners for other medical reasons, please be sure to follow your surgeon's and your physician's instructions as to when and if you need to stop them prior to your surgery. Also, be sure your physician and surgeon know about any herbal or nutritional supplements you might take, as a number of these have blood thinning properties as well. You should stop taking these 7 to 10 days before your surgery. There are a number of examples noted in this slide. Your surgeon and medical doctor may want you to take certain medications the morning of your surgery. Please be sure you understand these instructions and follow them. Now, if there are any questions as to what you should or shouldn't be taking, and it isn't clear in the instructions you've received already, please call your surgeon's office or your physician's office for guidance. We take infection prevention very seriously, and you are a very important member of our infection prevention team. In preparing for your surgery, we will ask that you shower the night before your surgery as well as the day of. Your surgeon may request you to use a specific soap and may request you to shower more often than the day before. If they do, please follow the instructions that accompany the soap and use as instructed. We ask that you use clean sheets and towels the night before your surgery. Also, please avoid shaving your legs for 3 days prior to your surgery. It is important to avoid scraping or cutting your legs prior to your operation. Should you cut or open a wound on your leg prior to surgery, please contact your surgeon to let them know. Now, if there is a need for dental services within 1 to 3 months of your surgery, Please contact your surgeon to make them aware. Depending on what needs to be done and the reason it needs to be treated, your surgeon may request that you postpone the dental service, or if unavoidable, your surgeon may choose to postpone your surgery. Also, please avoid getting any tattoos or piercings 3 months prior to your surgery. If you have piercings, please remove all prior to your surgery. And if there are any questions regarding this, please contact your surgeon. And please follow any other instructions you might have received. Your medical team recognizes the importance of stopping smoking prior to your surgery. It is preferred that you stop smoking at least 1 to 2 months prior to your operation. Smoking can interfere with healing, increase risk for infection, and contribute to possible complications after your surgery. Talk with your surgeon and your general physician. They can help with resources and possible strategies to help make the process of stopping smoking more successful. Your hospital may be able to offer resources as well. We encourage eating a well-balanced diet in the weeks leading up to your surgery, and we ask that you stop consuming any alcoholic beverages at least a week prior. Please follow all instructions you receive regarding eating and drinking. Not following the instructions could lead to postponing or canceling your surgery. If you have received no instructions from your surgeon, then do not eat or drink anything after midnight the night before your surgery. If there is any confusion as to eating or drinking instructions, please contact your surgeon. Your preparation should continue in the home as well. Remove any throw rugs, as these can be trip hazards. And if you have area rugs, using double-sided tape can help keep those corners down and being trip hazards as well. Be sure there are clear walkways that will allow you in a walker or crutches to move freely from room to room. And we suggest having night lights to help with safety if you need to walk around when it's dark. Have some meals prepared in advance that may only require heating. And find taller, sturdier chairs that will make getting in and out of them easier and safe. A good guide for sitting is that your hips should be at or higher than the level of your knees when you are sitting. And this will be important if you're receiving a total hip replacement and they use an approach other than an anterior approach. Pets can get underfoot, and steps for your safety are encouraged. If there is a fear that your pets will or could cause you to trip and fall, we ask that for a week or more, you have someone care for your pets. Now, if your pets stay with you during your recovery, please have an area that they do not go as a place to perform bandage changes. Though your pets are well taken care of, washing your hands after petting them will help reduce the risk of infection. Be sure to fill medication in advance whenever possible. This will avoid missing doses and will lessen the number of errands those who are keeping a watchful eye out for you will need to make. And be sure to have a key available for each of the people who will be assisting you after your surgery. Though we are confident everything will go smoothly in the days leading up to your surgery, there are a few things to keep an eye out for that could require postponing your surgery. First, we need your skin in and around the area you're to have surgery to remain healthy. Should you have any bumps, rashes, redness, open wounds, bug bites, or infected nails, contact your surgeon. They will need to examine to assure it is safe to proceed with surgery. Also, we want you healthy leading up to your surgery. If you're experiencing any cold or flu-like symptoms, fever, chills, cough, sore throat, runny nose, nausea, vomiting, or diarrhea, please contact your surgeon to make them aware. You may need to follow up with your general physician as well. You'll be given instruction regarding pre-registering for your surgery. This could be a simple phone call, a visit to your hospital's pre-screening clinic, or require a visit to the admitting department. And this should occur on or before 3 to 5 days prior to your surgery. If none of the three options have occurred within 3 to 5 days of your surgery, please contact your hospital's or surgery center's admitting department for further instructions. You'll be told when you are expected to arrive to the hospital or surgery center and where you should check in. The staff will be sure to get you to the correct area for your preoperative preparations. Please be sure that you follow any instructions regarding any morning medications you are asked to take, and be sure that you have followed all eating and drinking instructions. Once you've been checked in, you'll be taken to your room. 1 to 2 family members or friends can join you in this room. Your nurse will have you undress and put on the appropriate garments. They will take your vitals, including temperature, pulse, blood pressure, and oxygen levels, and they will assist with any specific preoperative cleaning. An IV will be started, and you may receive medications ordered by your surgeon. You may be asked to complete any additional forms and asked to answer a few questions on a survey designed specifically for the surgery you're about to have. If you've already answered this survey, let your caregiver know. It is during this time between checking in and heading into the OR that you will meet with your anesthesiologist and your surgeon to go over any last-minute questions. During these discussions, your surgeon will mark the side you are having surgery on. Staff, surgeon, and anesthesiologist will again confirm that the procedure matches the patient, the correct side is marked, and all the paperwork has been completed. This is an important regulatory timeout to ensure that correct surgery is being performed on the correct person to the correct side. You will be wheeled into the OR and assisted onto the table. The staff will position you in such a way that the surgeon will have the best view for the approach they are planning. Your anesthesiologist might give you a spinal once you're in the OR to help with pain control. And once you're under anesthesia, the staff will perform their usual duties in preparing for surgery with and under the direction of your surgeon. If a urinary catheter is necessary, it will be placed in the OR. Before you know it, your new joint will have been replaced and you will be taken to the post-anesthesia care unit, or PACU, what we commonly call the recovery room. In the recovery room, you'll be under the watchful eye of our PACU staff as you continue to come out of anesthesia. Your IV and the oxygen you will be getting through a mask will help with your waking up. The staff will keep an eye on your blood pressure, heart rate, temperature, and oxygen levels. Once the staff is confident that you have adequately come out of the effects of anesthesia and any post-operative x-rays have been completed, you will then head to your designated room. Your family and friends will be directed where they can wait while you're in surgery. Surgery is anticipated to be about 1 to 2 hours, depending on the extent of the surgery required. The time in the recovery can be about 1 to 2 hours as well. The surgeon, the surgeon's assistant, or an OR staff member will meet with the family or friends after surgery, and if there are any anticipated delays. Your room for the remainder of the stay will be specific to your orthopedic, medical, and rehabilitative needs. The rooms are spacious enough to move around and to accommodate visitors. Now, should you be staying overnight and a family member or friend want to spend the night as well, please talk with nursing to ensure appropriate arrangements be made. While with us, there will be a team of staff members caring for you under the direction of your medical team, which could include your surgeon and possibly a hospitalist or attending physician. Your medical team will care for you on a daily basis, managing you from a medical and surgical perspective. The nursing team will check in with you frequently to see how you're doing, provide medications, check blood pressure, heart rate, temperature, and O2 levels, assist you out of bed, and any of your other needs. You will have a call light that we want you to push anytime you need anything, including getting out of bed to use a restroom or to get back into bed if you've been sitting. Physical therapy will see you regularly to prepare you functionally for your return home. And occupational therapy may be asked to see you should there be any self-care needs or instructions required. You will find a communication board in your room to help with orienting you to the day and the date. It will commonly have the names of the staff caring for you at the time, including your surgeon and your hospitalist, and any other instructions for incoming staff. Most of our rooms are private, and it is our hope to make for a comfortable space for you and your guests. Television is available, and please ask a nurse if they can provide you with a station guide. Now, should you or your guests want, free Wi-Fi is available. It's commonly noted as PHS Guest when you look at the Wi-Fi networks list on your device. There is a page you'll be asked to agree, acknowledging that you are using a public Wi-Fi. If you have any difficulties, please don't hesitate to ask a staff member for assistance. It isn't uncommon after anesthesia and some of the medications you receive that you could experience nausea. Your nursing staff will start you with ice chips and they will progress you to liquids and food depending on your tolerance. We will adjust diets based on your individual needs and the direction offered by your medical team. Special diets, if you're diabetic or have cardiac concerns, will be under the direction of your medical team. But please let your nursing team know if you have any special dietary requests. Depending on where you're receiving your surgery, instructions on arranging for meals may differ. Your nursing team will be able to guide you to help with make any necessary arrangements. There are a variety of tubes and lines you might anticipate having when undergoing a total joint replacement. Variability is dependent on the surgeon and the anesthesiologist. Your medical team will give instruction as to when these can be removed. It is our goal to manage your pain effectively. We want your pain levels tolerable enough to rest and tolerable enough to participate in therapy. Our staff members will commonly ask you your pain levels. 0 is no pain, and 10 is the worst pain you could ever imagine. We don't believe that pain-free is a reasonable goal considering the extensive nature of the surgery you received. We anticipate that there will be some discomfort. The level of pain you are experiencing will help us in delivering the correct medications at the right time to keep your pain tolerable and allow you to participate in your recovery. To help keep your pain under control, we have instituted a multimodal approach. This means we will use a variety of approaches to help manage your pain. This can include ice and elevation when appropriate, gentle movement, nerve blocks, spinal blocks, injections around the surgical site, non-narcotic and narcotic medications. Based on how you're feeling, pre-medicating prior to therapy will allow you to gain the most from your therapy sessions. Through the years, we have recognized that opiates, though they can help with pain, have a number of common side effects, such as nausea and dizziness, low blood pressure, drowsiness, constipation, respiratory depression, up to dependency and addiction. Because of this, we have instituted our multimodal approach to use a variety of methods for pain control. Your medical team will determine which options would be safe and appropriate for your pain management. These can include acetaminophen, anti-inflammatory medications or NSAIDs, nerve pain medications, ice packs or cooling units, elevation, paced return to activity, and narcotic medication can be added should these options not work adequately in controlling your pain. There is a very good chance you won't need all the medication that you are prescribed. It is not safe to have medications, including pain medications, sitting around the house when there is a chance that they could be mistakenly taken. There are options. Check to see if your hospital can dispose of unused medications for you. Check in with your pharmacy to see if they are able to dispose of unused medications. Go to the website noted in the slide to see if there is a drug disposal site near you. Lastly, it is okay to put in the trash, but be sure to mix with something unappealing like dirt, kitty litter, or used coffee grounds and place in a sealed container. Throw away in your household trash and be sure to scratch out all information on the prescription bottle before throwing out. Anesthesia, pain medications, and inactivity can decrease your ability to take full deep breaths. This can lead to complications down the line. These complications can easily be avoidable with certain interventions. Take deep breaths. Breathe in as deep as you can, hold it for a second or two, and then exhale out as much air as you can. And do this about 10 times an hour. Also, cough. It's good exercise for your lungs. Respiratory therapy may bring you a device called an incentive spirometer. Follow their instructions and perform 10 times every waking hour. Also, getting out of bed and sitting up are great activities that will help with your breathing, but only if you are directed and assisted by a staff member. These exercises should continue long after you leave the hospital and until you have returned to your normal activities at home. Though nobody wants to talk about it, constipation can be a real issue after joint replacement. Anesthesia, pain medications, and not having eaten for almost a day all can contribute to your bowels wanting to rest, which can lead to constipation. Here are some ways to help avoid this. Early mobility, drink plenty of fluids, and be sure your diet contains fiber with every meal. And this can come from fruits, vegetables, and grains. Let your nurse know if you have a history of constipation. Your medical team will determine if you'll be needing a stool softener. Laxatives and suppositories can also be used if there isn't a successful bowel movement with the other options. Please be sure that you are prepared to deal with constipation once you've gone home. Due to the trauma of surgery and early inactivity, there is the chance of developing a blood clot after surgery. Now, this can be successfully avoided with the following activities. Early mobility, or getting out of bed and moving with a caregiver, is one of the most effective yet simplest activities you can do to prevent blood clots. Ankle pumps, like you're pumping your brakes in your car, doing this frequently will cause the muscles to help push blood from your legs to your heart. And use of compression devices will also help push blood to your heart. These can be worn when you're in bed while you're at the hospital. Besides the activities you can do to help avoid developing a blood clot, you'll be placed on a blood thinner medication. This medication will interfere with your body's ability to form clots. Combination of medications and the various exercises and staying active will be very effective in keeping you from developing a blood clot. But just in case, let's go over some of the common signs and symptoms if you develop a clot. Clots often form in the leg, usually the lower leg, and symptoms can include swelling, pain or tenderness, sensation of having a cramp, and hot to the touch. If you experience any of these, talk with your surgeon. Swelling after surgery is common, but if you are concerned, please speak with your surgeon. If the clot works itself loose, it can move through blood vessels. It can normally come to rest and cause a blockage in the lungs, the heart, or in the brain. If there is a sudden chest pain, pain with deep breathing, unexplained cough, coughing up blood-tinged mucus, feeling of lightheadedness or dizziness, or signs of a stroke, please seek immediate medical attention by calling 911. Rehabilitation is a key component in being able to get home and ultimately in your overall recovery. Physical therapy will be a key member in your recovery. Physical therapists are experts in how your body's musculoskeletal system works. They will use this knowledge to assist and train you to be able to get in and out of bed, in and out of chairs, getting up to walk, commonly called gait training, stair training, participate in an appropriate exercise program, and all of the necessary education going forward, including safety. Physical therapy will also make recommendations for equipment needs and will train you in their use. Occupational therapy, if needed, will be able to assist and train to recover basic self-care activities that can be challenging after a total joint replacement. These could include exercises, bathroom activities, and assessment of the home safety and equipment needs. For those having total hip replacement, depending on the approach your surgeon takes, you might have precautions. Your rehabilitation team will educate and reinforce activities and movements you're to avoid to keep your new hip from getting damaged or dislocating. Commonly, with posterior approach total hip replacements, you must avoid bending your hip past 90 degrees, crossing your legs, or turning your surgical leg inward. Your therapist and the rest of your medical team will help reinforce these precautions. Our goal is always to get you home as soon as you're medically, surgically, and functionally safe. For a safe return to home, most patients should be able to at least perform the following: get in and out of bed, able to walk 50 to 100 feet, able to get in and out of chairs and on and off the toilet, able to do stairs and curbs if needed, able to perform a beginning exercise program, know how to use assistive devices, and understand all precautions where necessary. Your physical therapist will confirm these goals are met. Similarly, your occupational therapist, when needed, will be able to return you to some of the general activities such as grooming, simple bathing, dressing, and toileting. They will also ensure that you will know how to use any recommended equipment. Safety, again, at home is of utmost importance. Please be sure to have clear walkways. Floors should be clean and dry. Remove cords and move all objects out of the way, and use caution if pets are present. Please continue to use all of the assistive devices recommended by your therapists. Your therapist, in agreement with your surgeon, will let you know when you won't need those devices going forward. It is our goal to get you up and moving the day of your surgery. PT or nursing will get you up and walk the day of your surgery. Your team of caregivers will assist you in early mobility. This can occur in the recovery room or your patient room, depending on the setting where you have your surgery. Early mobility is one of the most important things you can do for increasing your function, your safety, and your health. Early mobility has been found to help decrease the risk for pneumonia, constipation, and developing a blood clot. It is also important that until you are discharged home, that you should always be with one of our caregivers. Use your call light to let us know you need assistance. Your therapy team will work with your medical team and case management to help determine your equipment needs. Your physical therapist will help you decide which assistive device is best for you. They will adjust it to fit you and teach you how much weight to put on your operated leg. Walking is part of your daily PT session on both level ground and stairs when necessary. Not pictured is a device called a CPM. Occasionally, your surgeon will feel that this device will be necessary after receiving a total knee replacement. It moves your knee repetitively through a range of motion. Now, here are some examples of equipment that might be recommended for you by your team. Your therapy team will work with your medical team and case management to determine equipment needs. Unfortunately, a number of these pieces of equipment are not always covered by insurances. We recommend you talk with your insurance to see what is normally covered and what is not. Some equipment isn't normally covered by your insurance. If you have your own equipment or can borrow equipment from a friend or a family member, please have it brought to the hospital and our staff will help fit it for you. Remember to contact your insurance to investigate what is actually covered. Now, if your insurance won't be covering your devices, you do have options. You can purchase new equipment online or through medical supply houses. You can also look for devices at the Goodwill. Also, check in with family or friends to see if they have equipment you can borrow. Just know the equipment needed normally will only be needed for a short period of time. After preparing to go home, your caregiving team will have instructions for you on how to care for your incision. They will let you know when you'll be permitted to shower and what you might need to do to keep your incision safe. Now, when will I be permitted to drive is a popular question. Your surgeon and your therapist will help in determining when you'll be safe to drive. If you're a passenger, we recommend continuing your ankle exercises to help keep your blood moving and to get out of the car and walk a little every 30 to 45 minutes. If your surgeon says it is safe, you will be permitted to travel. Your team will give you instructions on how to travel safely. Also, your surgeon will give you instructions regarding dental care for before and after surgery. It is common that you will need to take an antibiotic prior to cleanings, dental work, and some invasive medical procedures. Work with your surgeon and your physician for any arrangements that might be needed. It is always anticipated that our total joint replacement patients will be discharged to home. Research indicates that your home is the healthiest place to be for your recovery. Our staff will work diligently to be sure your return to home will be successful. And part of this success is to pre-arrange for family or friends to be accessible to you for your first week while you're at home. You will be able to get around, but lifting, running errands, getting to doctor appointments may require some help. Now, on occasion, some of our patients may need a short stay in a skilled nursing facility for more supervised physical therapy to ensure a safe transition home. Since the risk of infection is increased when staying in a skilled nursing facility, it is our hope that you'll be able to get home as soon as you are safe. Though we talked about it earlier, our staff will want to be sure that you can get up and down from chairs, in and out of bed, and able to walk short distances with assistive device around your home and be able to overcome any anticipated obstacles like steps and stairs. If it is necessary, your medical team will order home health to see you in your home. This will normally start within 24 to 48 hours of being discharged from the hospital. Home health will normally continue until your first post-op appointment with your surgeon. Your surgeon will determine your readiness to begin outpatient therapy when it's indicated. Believe it or not, a number of our total joint replacement patients are going home the same day of their surgery or post-op day 1. Otherwise, if medically indicated, patients may stay a night or two in preparation of going home. Because of how quick patients are now able to go home safely, case management will be working with you, oftentimes the day of surgery. They will help in arranging needed equipment, home health, and follow-up appointments with your MDs. Case management stays in close communication with therapy and your physicians to prepare for a successful discharge. So, let's talk about getting ready to go home. You'll go home in the comfortable clothing we talked about at the beginning of class. Therapy may need to see you one last time to be certain you are functionally ready. Make sure your ride is arranged ahead of time. Normally, we'd like to have our patients leave in the late morning or early afternoon to avoid traffic and to go home in the daytime, as this will make it easier to maneuver around the house. Please let your nurse know a few hours in advance as to when your transportation will be available. Your nurse will be able to meet with the appropriate staff and physicians to ensure all of your paperwork and prescriptions are ready for your discharge. Your nurse and physicians will give you a number of instructions, and we will summarize these in your discharge instructions. Make sure you continue with washing your hands, especially if you do your dressing changes. Continue doing your ankle exercises and breathing exercises every hour. Once you're back to your normal activities, you can start to back off these exercises if you'd like. Remember to ice and elevate your leg. This can help with discomfort and lessen any new swelling. You can use pillows to elevate your leg, but remember to put under the lower leg and not under your knee. Your nurse and surgeon will let you know when you can start showering, and you'll be instructed on how to care for your incision and how and when to change your dressings. And keep up with your exercises and remember to get up and move every hour. The time and effort you put into your activities will really make a difference on your recovery. Once you're at home, keep up with all your exercises you were taught and remember to get up and move. Refer to your total joint book. It can be helpful for any questions you might have. If you can't find your answer, contact the orthopedic program manager or navigator who worked with you at the hospital or call your surgeon's office. You can anticipate being referred to the appropriate setting to continue your recovery. This might include home health, outpatient physical therapy, or virtual therapy. Home health will begin within 24 to 48 hours of your discharge home. Virtual therapy or outpatient therapy will begin when your surgeon feels you are ready. Lastly, go to all of your follow-up visits with your surgeon, usually within 7 to 14 days of discharge, and your general physician within the same time frames. We are here for you, and we appreciate the time you'll take to do any of the surveys before surgery and surveys that follow. These will help your surgeon and our program to really meet the needs of our patients. Staff may reach out to you to see how we might be able to make completing these surveys easier. And we are excited about offering Twistle at a number of our hospitals. Twistle is a messaging program that will work through your phone and giving instruction and reminders as you approach your surgery and as check-ins after you go home. Your response to these post-op messages are important. Your surgeon's office will be made immediately aware of any responses that might benefit from at least a phone call. The pre-op class, like this program or in the in-person class, gives everyone the opportunity to be better prepared for their surgery. Our research has shown patients who are better prepared have a smoother recovery. Not to mention, if you're able to make it to the class, you'd have had the option to meet with one of the staff members who will be following you while you're with us, a valuable resource during your journey. We've developed this tool for you to have as a handy reference, and you'll receive this from your navigator or the hospital staff. And we definitely don't want to alarm you, as what we're going to talk about next rarely occurs, but we find that early intervention for something out of the ordinary can increase your confidence in your recovery. So call your surgeon's office if you run a fever. Could just be a cold, but your surgeon will want to be certain there isn't any chance of infection. And as you'll be moving around and exercising, we anticipate there to be occasional dry blood or drainage on your dressings. But if there's a lot of bleeding, or if the drainage is bad smelling, or white, gray, green in color, your surgeon will want to know this immediately. If there is increased pain, swelling, redness, warmth, call your surgeon. This can be normal as you're continuing to move more and exercise more. Swelling is possible, but in the slight chance there is an infection, your surgeon needs to address this immediately. Now, if you're having chest pain, shortness of breath, signs of a stroke, call 911. Paramedics can begin caring for you immediately and get you to the ER physician immediately versus trying to have someone drive you and potentially delaying getting to the immediate care you'll need. Also, if there is numbness or blueness in color of the extremity, this could be a clot blocking an artery and time is of the essence. Call 911. Lastly, if you fall, the chance of fracturing or loosening the implant is possible. You'll need to get this x-ray. Here are a few of the burning questions we commonly get from our patients or their family and friends. I know we discussed the answers for the first two questions, but the third one is a good one. When will I be fully recovered? Well, there are a number of things that go into this answer. It takes 6 to 8 weeks for the bone, muscle, and skin to heal after the trauma of surgery. It can take at least an additional month or two of progressive exercises and treatment to build up your strength and endurance as you return to your previous functional levels. So, at least 3 to 6 months seems to be a reasonable amount of time. Some are sooner and some are a little longer. Remember, the effort you put into recovery will help get you back into your life. Remember, if you have any questions, please do not hesitate to contact your hospital's orthopedic program manager or speak with your surgeon. You've got this, and we are here with you and for you. Thank you for watching.